The great thing about Zoom is that you can always come to class half dressed. Hi, my name is Jason Nguyen. My partner is Gavin Holmes, and today we will be discussing COVID-19, the social disparity. Now, before we begin, I wanted to first tell you guys why you should listen. It's important to listen because as of right now, we are in the COVID-19 pandemic. We need to be aware of what's going on around us so that we can prepare for it, potentially even in the future. For example, if another pandemic like this were to happen, what would we do? What would be the consequences of our actions? So, in order to protect our future selves or our future generation and our kids, we chose to analyze this particular pandemic. Now, for our credibility, me and Gavin have been doing a lot of research on journal articles and peer-reviewed articles. All of these experts have compiled a lot of data that after me and Gavin have read, we believe that this makes us credible. Now, for a thesis, there is a lot of information to cover, from underlying issues with our American culture and its value system to mental health problems that are going on in students and teachers to innovations in technology, which is a positive of this COVID-19 pandemic. But of course, the quality of our education as well deteriorating because of not being able to get that hands-on experience. So with all of that information needing to be covered, we have decided, me and Gavin have decided to split this presentation into two main parts for each of ourselves. Gavin will be covering the first main 2 points, which will discuss the underlying value issue with our American culture, as well as the mental health aspects, while I'll be covering the quality of our education and the technology innovation. So here to start off our first 2 main points, here is Gavin.
Thank you for the wonderful introduction, Jason. I'm glad to see you're making the most of Zoom in quarantine as well. The United States was due for this massive pandemic due to American values and underlying distrust in the federal government that many Americans already had. For example, according to Samuel Perry, the need to see Christian values in the United States law system has only furthered skepticism around COVID-19 and has allowed it to spread to what it is today. All around the US today, we see many groups opposing mask mandates and gathering in large groups opposing these social gathering orders. We even see many people claiming that COVID-19 is a conspiracy and is fake. While that is completely untrue, their actions have only furthered the ongoing death count and the spread of this infectious disease. Samuel Perry shows that American skepticism has extremely hindered our own safety. Another facet of this issue comes from the American Public Health Association. Justin Chen discusses the deep-seated racism within American culture by stating, quote, "The current pandemic reinforces long-standing negative stereotypes of this rapidly growing minority group in reference to Asian Americans. Since the beginning of this pandemic, we have seen an increase in anti-Asian American rhetoric, such as the phrase, the China virus, as said many times by the former president of the United States. We have also seen a dramatic increase in the number of hate crimes against Asian Americans within the US. Besides revealing the faults in our culture, COVID-19 has done much more damage to other aspects of American society as well. The lockdowns from this pandemic have taken a severe toll on not only American life, but on the mental health of many American citizens as well. And during the midst of a pandemic, a mental health crisis has emerged. According to Nirmita Panchal, around, quote, 1 in 10 US adults reported symptoms of anxiety or depression in 2019. However, as of February of 2021, that figure has jumped up to 4 in 10 adults. This massive scale of adults in the US suffering from anxiety or depression represents the severity of the current mental health crisis taking place in the US today. Additionally, in an interview, Elisa Lincoln of Northeastern University claims that the distrust we currently have in the US is, quote, also having an effect on our mental health and well-being. As Americans, we have seen the increase of social unrest and the increase in distrust in our government. Both of these factors have contributed to the degradation of our mental health and well-being, and has contributed to the chaotic environment that we currently experience today in the US. Many Americans are suffering, and a lot of the social unrest and intensity within the US is only furthering those issues. With the results of these two sources, we have seen that COVID-19 not only affects the physical well-being of somebody, but also leaves a devastating mark on the mental well-being of people. Now, although severe damage has been done to many parts of our society, one bright spot has been the education industry. Here's Jason for more.
While discussing COVID-19's effect on our education, it's important to note the huge technological push that's going on. Coming from Christina Romero Ivanova and her colleagues, she cites multiple aspects of the educational system that both students and teachers now have to learn because of COVID-19. This includes, quote, learning new software and navigating copyrights, which is a good thing because teachers and students are learning new things such as Canvas and Zoom are now able to apply it to everyday learning experiences. And the amount of tools that we have to learn has increased. Now, coming from Tiffany K. Knoll, another source, she cites how this COVID-19 pandemic has been a wake-up call for many school systems to realize how important it is to have technology in our lives, especially in terms of teaching. So overall, both of these sources tie back to one main point, being that it's easier to teach with technology, and especially with this whole social distancing, we have learned how important it is to have technology. Now, the quality of our education is another thing, as this next point we'll discuss. When it comes to our generation's workforce or the incoming workforce, uh, Edzegi Edigan and her colleagues have discussed how all medical schools are suffering from a lack of training. Hands-on experience is on an all-time low because none of these students can get the proper live training that they need. And so many doctors and nurses are graduating from medical school having not as much experience as previous generations. Kara Thiet and Zhu Ming are two students from medical school who know their lack of proficiency and know how they want to have more hands-on training and be able to have as much proficiency. But of course, with how things have been in COVID-19, that hasn't been possible. So overall, with both of these sources, there has been a hampered proficiency in training across the board that needs to be addressed somehow. But of course, it's not going to happen anytime soon. So with that being the last main point, I'm going to now hand it back to Gavin for our conclusion.
Given our research, COVID-19 proves to have a wide array of effects that span from exposing the faults in American values, pushing the mental health of the quarantine, pushing the technological movement into the realm of education, and lowering the quality of America's future workforce. Samuel Perry reveals American issues with balancing freedom and rules. General consensus across all sources related to mental health show that COVID-19 has pushed a large percentage of American citizens to their mental limit. Education has innovated in their way by teaching, by using technology to its best extent according to our sources. But the quality of this education remains questionable, as the medical field shows. This pandemic was unexpected, and it could happen again in the future. So folks, be prepared and stay comfy in those pajama pants. Thank you.